My name is Danielle Zweers and I'm working at the University Medical Center in Utrecht, which is in the middle of the Netherlands. And I'm an oncology nurse since 2010 and working in a domain within the medical oncology. And besides that, I'm doing a PhD thesis, which is about anxiety management in advanced cancer patients. Anxiety management within the nursing domain is really dependent on the knowledge and skills and experiences of individual nurses. And this is because there is a lack of evidence in anxiety management interventions, which could be potentially effective. So this gap of knowledge was for us a reason to set up a project with aims to develop an intervention set to assist nurses supporting anxious cancer patients. So we ask nurses what they need through online survey and several focus group sessions, and they had a consensus that it would be very helpful to know which patients are at risk to experience anxiety. So we set up a study, and we concluded that for our population, which is terminally ill cancer patients who recently were admitted to a hospice, that dyspnea and depressed mood are significant predictors of anxiety. However, the previous studies and the outcomes of that are inconsistent. And the reason why remains unclear. So for daily nursing care, I think we should be aware of potential predictors of anxiety and which interaction and meaning for that patient, so we can set up a tailored care plan according to the needs of the patient. And we need to move to more uniformity in research methods, so we can improve and increase in comparability to build a body of knowledge to really understand what is going on. So to conclude, my views on anxiety management is that the quality of that is dependent on the skills of the individual nurse, and more knowledge is needed. Well, that's a difficult question, but when I think ahead about a couple of years, I hope our intervention set will reach nurses across Europe and will equip nurses with the right tools and knowledge and skills to care for people with anxiety. And I hope the EONs will help me to support this ambitious goal. Yeah. It's really great to be here with so many colleagues for a few days, and it gives me interesting reflections and new inspiration. And I think that's needed to continue the work in oncology nursing, and on the one hand, and research at the other. And I think the theme of this year, balancing healthcare needs in a changing context, is a theme that we're all confronted with, and it helps to discuss those issues in a broader perspective, and not only between the four walls of your organization or your community, and to connect and learn from each other. And I think it's great. And last but not least, but also enjoying the wonderful city of Dublin.